Hi, my name is Michelle Bailey, and I am going to be performing an abdominal exam on my fiance. Today's date is 4/18, 2024, and the time is, I don't know what time it is. It's probably like 9 in the morning. um, I already contain, or I already got consent for her, but I'll do it again on the camera. And this is Hannah Ross. And is it okay if I record you on the video? And
Yes.
thank you. And then I'm going to upload it on YouTube as unlisted for my instructor to grade.
Sounds good.
Okay. So there's consent. And then I'm going to do a 360 around the room. Oh, shit. Get out of the way. So I'm in my bedroom. There's no paperwork or anything or papers. I'm packing for immersion tonight, so that's why that's there. This is a complete circle of the floor. Nothing is there. Again, I'm going to set the camera down to start my exam.
You gotta go back that way.
This way.
Right
Whoopsies.
here.
This way.
And turn it.
And
Turn it.
turn the camera.
Turn the whole thing.
Oopsies.
Turn the whole thing. Go right
Moving
there. Now go back that way. Turn the whole
this
thing.
way.
Right there.
Right there.
Straight.
Is that good?
Step off.
Huh?
Make
Is
sure there's no.
that good?
Mm,
Or back a little bit.
that's okay, I guess.
Can we see your belly, right?
Mm-hmm.
Okay.
Tell me if you're okay with that.
Yeah.
Okay, view?
Yeah, it looks
Okay.
good. All right. So the first thing that I'm going to do is make sure my patient is comfortable. She has a pillow under her head. And then I'm going to place this pillow under your, it's okay for your knee, like under your legs for more
Yes.
comfort? Okay. Beautiful. I already washed my hands. I'm going to pretend I have gloves on. I don't need gloves right now. And then can you lift your shirt up a little bit more? Beautiful. So this is so we can, thank you. And you can place your arms down by your side if you like. Or if you don't want to, it's okay, whatever you want to do. All right, and then we show all or the whole belly. So the first thing that I'm gonna do before I even touch my patient is introduce myself. Hi, my name is Mimi. I'm gonna be your nurse practitioner today, and then we're gonna be doing an abdominal examination on you. Okay.
Sounds good.
All right. So the first thing that I'm doing is looking at the abdomen. I'm looking and I'm checking for just rise and fall of the belly. I'm looking for any type of discoloration, jaundice, ecchymosis, any type of bruising. I'm also looking for any type of, bless you. I'm also looking for any type of contour abnormalities, hernias, any type of, I'm looking at the umbilicus as well, if it's an innie or an outie. And then I'm looking for the peristalsis of the belly, the motility. And then I'm checking right up here above the umbilicus area for the pulsation of the aorta. So now that I'm done inspecting the belly, I'm going to go ahead and auscultate with my stethoscope. Sorry, my hands are cold. And the stethoscope is probably cold too. Sorry. So I'm just going to try and warm it up for her. So I'm going to start by listening in the right upper quadrant. Oh, and I could hear vowel sounds that are active, and that's what I'm listening for. So here on the right upper quadrant, and then I'm listening here on the left upper quadrant. I could hear your belly. And then I'm going to go down to the left lower quadrant. Listen. And then I'm going to listen here on the right lower quadrant as well. Okay, once I'm done listening to all four quadrants, I'm going to move to the above area, the aorta, which is above the umbilicus. And I'm going to listen here. I'm also going to listen to the right and left side, which are the renal arteries. So starting here on the right side for the renal artery, and then moving over to the left side renal artery. So here I'm listening for any type of bruise, any type of abnormal sounds. I'm going to move down past the umbilicus and listen to the right iliac artery, and then also the left iliac artery as well. And I'm going to continue going down right over here where the right femoral artery is. Just going to tuck under a little bit. Listen there, and then I'm going to listen to the left femoral artery as well. Again, I'm listening for any type of bruise, any type of abnormal sounds I may hear. Once I'm done listening there, I'm going to listen over the liver, which is located in the right upper quadrant area, right around the 12th rib. Here, I'm listening for any type of friction rubs, any type of abnormal sounds I may hear the liver. And then I'm going to move over to the spleen area, which is located under the ribs on the left side. I'm going to go on this, I think it's the lateral axle side, excuse me. And I'm going to listen, find like the 12th rib over here. And I'm just going to place my stethoscope up 11 10th, around the 10th rib intercostal space to listen for the spleen. Again, for any abnormal sounds, any friction rubs, or anything like that. I forgot the bladder. So down in the pubic area, I'm going to move down to the bladder. Listen over the bladder as well. This is really cool. And then I'm done with listening. So once I'm done with listening, I'm going to feel. And the first thing that I do to feel is going to be the tactile firmitus. So I'm going to take my non-dominant hand in the right upper quadrant. Sorry, my hands are a little cold. And then I'm going to take my my dominant hand, and I'm going to strike the middle distal portion of my middle finger, listening for sounds of tympany, first in the right upper quadrant. Then I'm going to move over to the left upper quadrant, listening for tympany, dullness. Down to the left lower quadrant, over to the right lower quadrant. Great. Listening for sounds of tympany again, and yeah, all that. And then I'm going to move over to the liver. So this is the umbilicus, and then the hip bone. And then I'm going to move up like mid-clavicular, the 12th rib, move up to the liver, which is in the right upper quadrant. And that's where I'm going to locate it and feel for tympany. Oopsies. Tympany, moving up to dullness. Right there is dull. So we're gonna measure. This is the liver, so I'm gonna measure the liver right here. So this is the first part that we're gonna mark. She actually has a little mole here, so I'm gonna use that as my marker. And then I'm gonna follow it up, looking for tympany and then dullness. I'm just gonna slide up under here just a little bit. Dullness. Oh, right there. Dullness is where this is the bottom liver border. The top border is going to be, the measurement is from here to here for the liver, which is going to be anywhere between 4 and 7 centimeters. And then I'm going to move over to the spleen area to palpate that. And then, so I'm going to find, my hands are cold, sorry, the rib, the bottom of the rib, which is the 12th rib, right about here. I'm going to count up to 11, 10. The intercostal space is where the spleen should be located. And I'm going to, yeah, it's dull. So that's where it's located. The dullness is here. And that's there. And then once I find the spleen, and that's good, then I'm going to move on to palpation. And I'm going to first start with, sorry, I forgot the bladder again. I keep forgetting the bladder. Gonna move down to the pubic area, excuse me. And I'm gonna go down here again. There's tympany, should be tympany sounds. However, if there's a dull sound, then I would ask the patient if her bladder's full. Those are some of the reasons why you may a full bladder, a distended bladder, something like that, are reasons why you may find it to be have like dullness. And then, so after I'm done with the tactile formatus, I'm going to move to the palpation. So I'm going to do light touches first with just one hand. I'm going to start in the right upper quadrant. So here, feels okay?
Mm-hmm.
All right, just feeling for any abnormalities, any pain, watching the patient's face, making sure everything's okay. I'm going to feel here in the left upper quadrant as well. I'm going to move down to the left lower quadrant, feeling. And then I'm move over to the right lower quadrant, feeling there as well. Once I touch all 4 quadrants, I'm going to go in for a deeper palpation. And I'm going to start in the right upper quadrant using both my hands this time for a deeper palpation. Feels okay? Mm-hmm. All right, good. You're doing great. Moving over to the left upper quadrant. Down to the left lower quadrant. And then over to the right lower quadrant. Anything, any pain or anything like that? Okay, great. And then after I'm done palpating and deep palpating the 4 quadrants, I'm going to move over to palpate the liver. So we know where the liver spot is here already in that right upper quadrant area. I'm just going to feel softly first. Feels okay. Then I'm going to feel a little bit deeper here. And then, can you take a deep breath in for me? Deep breath in. Very nice. Okay, release. And then when I push in for that deep palpation, I can feel the border of the liver on the tip of my fingers. Another technique that I can do to feel this liver is the hook technique. So I'm just going to step to the side, find her ribs here, the 12th rib here, bring my hands in, and then do kind of like a hook mechanism and hook this in. And I'm sorry, wait, hold on. When I did that deep palpation, I forgot to say that it's down and up. When she takes, let's try it one more time. So we're going to go for this palpation of the liver. It's going to be down, pull a deep breath in, down and up. Yeah, much better. All right, then release. Forgot that part. Then the hook technique is where I'm going to go up under here, under the rib. And I'm going to hook on nicely and go ahead and pull a deep breath in. Very nice. And you should feel, and release. Beautiful. You should feel the bottom border of the liver there as well. When I move over to the spleen, it's that same space over here in that 12th rib, moving up, 11, 10, 10th intercostal space. And actually, no, under that 12th rib, actually right here, we'll just palpate first. And then I'll have you take another deep breath in, deep, 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 deep. Very nice. You should not be able, and then release, you should not be able to feel the spleen at all. You should not be able to palpate the spleen. If for some reason you can palpate the spleen, that's an emergency. The patient needs to get seen right away. That's splenomegaly, an enlargement or some type of inflammation in the spleen. So you should not be able to do that. You should also not be able to hear the spleen as well. Or yeah, should not be. You should not be able to hear it. Wait, no, not hear it. You should not be able to. Never mind. I forgot. Okay. So, anyways, that completes my abdominal exam. So now I have a few tests that I'm going to do. The first test is going to be, I'm going to test the Murphy sign, which is going to be a test for the gallbladder. So the gallbladder is located behind the liver. And with the Murphy sign, if it's positive, then that would indicate a cholecystitis. which she's very familiar with because she just had a recent one. So I go up here in that right upper quadrant area where the liver is. And I kind of do like a deep palpation for her. So go ahead and pull a deep breath in. And on inspiration, oh, I felt that. Do you feel that? All right. Any pain when I do this? And let go. So to know that it's a positive Murphy sign is on inspiration. If the patient cessates to breathe or has a cessation of breathing during inspiration as you're pressing down, then that's a positive Murphy sign for the chole. And it needs to be followed up with more tests, lab work, all that good stuff, diagnostic stuff. So that was the Murphy sign. And then I want to do the, to rule out the appendicitis. So the rebound tenderness sign. So your appendix is going to be located right down here in between the umbilicus and the hip bone, like about 2/3 of the way down in the right lower quadrant. I'm going to press like a little light palpation here, no pain or anything. All right, great. Then I'm going to go in for the deeper palpation. Go ahead and take a deep breath in. Beautiful, release. And then so the kind of like pop back, because you asked the patient, did it hurt on the inhalation or did it hurt when you release, which is that rebound tenderness. If there's pain in that area, then that would be a positive sign for the appendicitis. The last test that I'm going to do is called the fluid wave test. And then I'm just going to have the patient, can I have you just like place your arm like directly down the center of your abdomen? Great. That's good. And then close your fingers. Beautiful. So here we have them going down the center of their abdomen. And then I'm going to come in and firmly, quickly, but nicely, kind of do like a tap here and see if the fluid will wave over to one side. So again, I just go here and then I'll just do it on this side so you can see it in the camera. So the fluid wave test will go from left to right. And she's holding down there and come here and I just lightly touch and see if the fluid will wave over to the other side. And you can relax your hand down or up. Okay, so I think that's it. Thank you for watching. And that concludes the abdominal exam. Thank you.